Have you ever grabbed a leftover pill from your medicine cabinet because the pain was just too much to bear? Maybe a neighbor recommended something that worked for them, or you took it once before and it seemed to do the trick. If that sounds familiar, you are definitely not alone. This happens to millions of Americans every single day, and it is not because people are careless. It is because pain is real, it is intense, and we want relief right now. But here's what most people do not realize. Some very common habits around pain medications can quietly be doing more harm than good. And today, I want to have an honest, caring conversation with you about that, because what I'm going to share could genuinely protect your health in a very real way. If you are 65 or older and you live with some kind of pain, whether it's in your knees, your back, your hips, your hands, or anywhere else, this video was made with you in mind. I'm going to walk you through 3 very common mistakes that older adults make with pain medications, explain why these mistakes are especially risky after age 65, and show you what you can do differently starting today. Simple, clear, and straight from the heart. And before we dive in, if you have not subscribed to this channel yet, now is a great time to do that. It's completely free, and this is a place where you will always find trustworthy information about health, well-being, and quality of life, all created with care for people just like you. Hit that subscribe button and tap the bell so you never miss a thing. Before we talk about the mistakes, I want to share something important with you. The body of someone over 65 works differently than the body of a younger person. That is not a weakness. It is simply how human physiology changes over time. As we age, the liver and kidneys, which are the organs responsible for breaking down and flushing medications out of our system, work more slowly. This means that a medication a 40-year-old processes and eliminates quickly can stay in the body of a 70-year-old much longer, building up and causing unexpected effects. On top of that, most people over 65 are already taking other medications for blood pressure, diabetes, heart conditions, or cholesterol. And when you mix a pain reliever with other drugs without medical guidance, the risk of a dangerous interaction becomes very real. So let us get into the 3 mistakes, and I encourage you to read carefully because each one is more common than most people think. The first mistake: taking medication on your own without talking to your doctor. This is, without a doubt, the most frequent mistake of all. The pain shows up, and the first thought is, I have something in the medicine cabinet, let me just take one. Or a friend says, I take this stuff and it works great for me, you should try it. And so you take it, without knowing if that medication is safe for your specific body, without knowing how it might react with what you are already taking, and without knowing if the right dose for someone else is the right dose for you. Many over-the-counter pain relievers that you can pick up at CVS, Walgreens, or any pharmacy, like common anti-inflammatory drugs such as ibuprofen or naproxen, can cause serious problems with the stomach, the kidneys, and even the heart, especially when used regularly by adults over 65. Research has shown that regular use of these common anti-inflammatories can increase the risk of stomach bleeding and cardiovascular issues in older adults. Maybe you are thinking, but I have been taking this for years and nothing bad has happened. I completely understand that thought and I respect it, but some damage happens silently, building up little by little without showing any signs until the problem is already serious. That is exactly what makes it so important to talk to your doctor before starting any pain medication, even if it seems minor, even if it does not require a prescription. Your doctor knows your health history, knows what you are already taking, and can guide you toward the safest and most effective option for your specific situation. That conversation might feel unnecessary for a little pain, but it could protect your kidneys, your heart, and your stomach from serious trouble down the road. The second mistake: stopping your medication halfway through because the pain is gone. This mistake is incredibly common and completely understandable. The pain fades, you start feeling better, and you think, why keep taking a pill if I am not hurting anymore? That makes total sense on the surface.
But depending on the type of treatment your doctor prescribed, stopping early can cause the inflammation to come back stronger, or it can even reduce how well the medication works the next time you need it. Think about it this way. Imagine your doctor prescribes a 10-day antibiotic for an infection. If you stop on day 5 because you feel better, the bacteria that were still there, the tougher ones, start multiplying again. Something similar can happen with pain and inflammation medications. The inflammatory process in the body needs to be treated through the full course that your doctor recommended, even if the pain is already eased up. The guidance here is straightforward. Follow exactly what your doctor told you, all the way to the end. If the pain goes away before you expected and you're not sure whether to keep going or stop, call your doctor's office or your local clinic and ask. Do not make that decision alone in the middle of your treatment. Taking that extra step to check in is not a burden, it's an act of real self-care, and you deserve that kind of attention. The third mistake. Taking a higher dose because the normal amount just is not working. This third mistake is perhaps the most dangerous of all. The pain is still strong, the medication does not seem to be doing enough at the recommended dose, and the temptation to take one more pill is very real. A little extra won't hurt, but it can, and sometimes it can hurt quite a bit. As I mentioned earlier, the body of someone over 65 takes longer to process medications. When you take a higher dose without guidance, the level of that drug in your bloodstream can rise to a dangerous level, causing dizziness, mental confusion, a sudden drop in blood pressure, and in more serious cases, real damage to the kidneys and liver. And a fall caused by dizziness for an older adult can have very serious consequences: a broken hip, a hospital stay, a loss of independence that changes everything. A lot of people ask me, but what if the medication genuinely is not working? What am I supposed to do? The answer is clear. Go back to your doctor. If the pain is not improved with the treatment that was prescribed, your doctor needs to know that. Maybe the medication is not the right fit. Maybe the source of the pain is something different, or maybe there is a better option for your body. Taking more on your own is not a solution. It is an unnecessary risk to your health and your safety. Now that you know the 3 most common mistakes, I want to leave you with something to think about. Taking care of your health after 65 does require a little more attention, but it does not have to be complicated or overwhelming. The greatest protection you have comes from your partnership with your doctor and from having the right information. When you understand what you're doing and why, you make better decisions, and that makes an enormous difference in your quality of life and your independence. If you deal with frequent pain and you do not yet have regular medical care, let today be the day you decide to change that. Make that appointment. Do not wait until the pain becomes unbearable to take action. Consistent, guided care is the best medicine there is. Before I let you go, let me quickly recap what we talked about today. The first mistake is taking pain medication on your own without checking with your doctor first, even when it is available over the counter. The second mistake is stopping your treatment early because the pain went away without finishing the full course your doctor prescribed. And the third mistake, and one of the most dangerous, is increasing your dose on your own because the medication did not seem strong enough. Small, mindful choices like these can protect your health and your independence for many more years to come, and you absolutely deserve that. If this video was helpful to you, I have a small favor to ask. Share it with someone you love who also deals with pain. A family member, a close friend, a neighbor you care about. That simple gesture could make a real difference for someone important to you. And if you are not yet subscribed to this channel, please do that now. It's free, and this is a place where you will always have a friend ready to talk about what truly matters for your health and your happiness. Tell me in the comments, have you ever made one of these mistakes without realizing it? There's absolutely no shame in it. Most people have. Write it down below and let us talk about it. I read every comment, and your story might even help someone else. Take good care of yourself, and I'll see you in the next video.